Minutes, sponsored by Texoma Medical Center.
May is Asthma Awareness Month, and according to the Centers for Disease Control and Prevention, 26 million Americans, or 1 in 13 people, have asthma. Pulmonologist Dr. Sanober Kable joins us today to talk about this condition and to offer some tips on how to avoid those triggers that can cause it. And Dr. Kable, what makes asthma different from other respiratory ailments?
So asthma is a chronic condition. The most important thing to know about asthma is that the patient's symptoms can vary from day to day, from time to time. In the morning, they might be more short of breath than in the evening. So it's a reversible disorder of the lungs. So if we can treat the triggers, we can treat the symptoms really well.
Okay, so what are some of those things that trigger asthma attacks?
Trigger control is very important for asthma management, and the triggers include, strong perfumes, colognes, smells, dust mites, cats and dogs, even anxiety. Any emotional stresses can trigger asthma attacks as well. So knowing your trigger is very important.
Now, if allergens are a trigger for us, how do we avoid those allergens that might cause an attack? Their allergens could be two kinds: food allergens and environmental allergens. If it's environmental, like let's say if somebody is allergic to dust mites and dogs and cats and mountain cedar, you really can't avoid those, but you can take medications or treat allergies to prevent them from triggering an asthma attack. Okay, so you just basically answered my last question, but are there other ways to treat asthma aside from those medications?
Absolutely. So I think if we talk about asthma management, inhalers are very important. Every person that has asthma must have a reliever medication, and they should have a controller medication if their symptoms are daily. And the other important things are treating allergies. As I said before, there are allergy shots, there could be pills that could be taken. And then last but not the least, I would always mention bronchial thermoplasty. If a patient has severe persistent asthma, we have done everything and they're still symptomatic, then we do have bronchial thermoplasty. That's a procedure that's done with a bronchoscope, but it can be life changer in some patients.
All right, well, great information. Dr. Kable, thanks so much for joining us today.
You're welcome. Thank you.
We'll be right back.